Chairman, thank you. So, yes, Dr. Clifford Porter, I'm the Healthcare Policy Director at Texas Public Policy Foundation. I also represent myself as an practicing physician locally using the direct primary care model. So my patients are, essentially held hostage to their own health by the high costs and paying far too much unnecessarily. So the wholesale and direct cash prices actually are far cheaper when we bypass the insurance PBM corporations. So examples is most common generic drugs are actually less than $1 a month, even though many are paying $5 to $10 copays, 500 to 1,000% markup just on copays. EpiPens, for example, we just did an op-ed on that, they're now $300 for a pair. I can do an equivalent if we change the laws for $6 to $7. So enormous savings are possible. X-rays and imaging, for example, I can get them for $50 cash price locally, but I had a patient who had to pay $109 for a copay and was threatened by the imaging facility. She had to use insurance and could be prosecuted if she didn't, which is just nonsense for it. Labs, another example, A1C's diabetes marker, that's $2.50. Testosterone, that's $4, but retail is quite often $50 to $100. So there's enormous savings that could be made if we bypass all these things. Surgeries, outpatient surgeries, quite often are 25%, not of the charge master, but of actually what's billed through insurance and hospitals. So other issues that are causing raising costs. Prior authorizations and step therapy that was just mentioned. A lot of these things are not based on medical decisions. They're called medical necessity, but really financial. These people are bypassing the medical standards of care. We need to have an even playing field and should be held accountable. This does bypass ERISA. ERISA is not a protection for this. I know I have a whole bunch of other points to make, but I support the idea of the PBM divestitures. The network restrictions are actually artificial, preventing competition, and ERS and TRS should look at HSAs.